Hello, my name's Amy Fish. I'm going to be doing my presentation on my evidence-based education innovation project. And I'm going to start off with just a little bit of background about the project and why I chose the topic that I chose. Um, when I first started looking at this project and what I wanted to do, I felt that it was important that I talk with the unit manager of my unit, which is labor and delivery. Not only did I want to satisfy the requirements for this project for school, but I wanted to come up with something that would be beneficial to the unit as well. So when I was talking with her, we went over some results of patient surveys. When our patients are discharged, usually the week or so after they go home, they get a phone call from the hospital asking them some questions. And there are some general questions that would apply to pretty much everyone. And there are more unit or patient specific questions. So our questions, of course, are going to center on their care and their experience on labor and delivery. One of the questions that they are asked is, did you receive education prior to going home on certain conditions? And one of those conditions is preeclampsia. A very high percentage, the time frame that we looked at, the percentage was 85% of the respondents said that they did not receive education on postpartum preeclampsia. So we identified that that was a definite need, and we needed to do better with that. So while ultimately our goal is that the patients are going to receive this education, we first have to focus on the staff. We need to make sure that the nurses are understanding postpartum preeclampsia and they know what to do, how to teach the patients, what to teach the patients. So we started with that, and that's how I came up with the decision to do education of the nursing staff on postpartum preeclampsia. A little more about the hospital where this innovation project is taking place. We are a small hospital on the coast of eastern North Carolina. We have 21 inpatient beds, which is a small number. We have a large emergency department, outpatient departments, and things of that nature. And our labor and delivery department is also fairly small. We have 2 triage rooms, 2 labor rooms, and 4 postpartum rooms. And our nursing staff, we have 13 nurses divided among day shift and night shift. So there's not a lot of us. I started out taking a survey of the nurses to determine what their process was on educating patients with postpartum preeclampsia. 4 of the nurses did not respond to the survey, and they cited the fact that they were night shift. They did not feel that they ever did discharges, so they just felt that they didn't have any useful information to offer. Of the remaining nurses that responded, only one nurse responded that she always teaches the patient about postpartum preeclampsia. So it was determined based on those answers that we needed to do some education of the staff. So the project itself will be an in-service to the nursing staff, and it will be held on labor and delivery. We have a conference room that is right off of the unit, so that's the location of the in-service. And I'm going to be using a combination of lecture discussion along with a PowerPoint and a handout that will go over key points of postpartum preeclampsia, signs and symptoms, and what to do if those symptoms occur. The nursing process theory is the theory that I come back to and that I feel all of this was based upon. The nursing process theory is pretty broad. It kind of just says that the nurse is providing the need of a patient to the needs of a patient. So I think that can apply to physical needs and it can certainly apply to educational needs. So I'm coming back to that as where this is all like coming from. So educating the patient is a big part of their complete care. You know, when a patient comes to the hospital, they generally are there for a physical reason, but education of that patient completes that care. So we're only, as nurses, doing part of our job and fulfilling part of our responsibility to the patient if we only focus on the physical care of the patient. And postpartum preeclampsia is a serious complication that can develop. It can develop during pregnancy, and it can also develop up to 12 weeks postpartum. So, and another statistic that I found just unbelievable when I was doing my research for this is that 60% of preeclampsia deaths are preventable. And that came from the Preeclampsia Foundation. And I just found that number to be, I was surprised at how high that number was. That's a lot of deaths that are preventable. So we are, as nurses, have an obligation to teach these patients. And in order to teach them, we have to be knowledgeable and we have to know all of this information and be comfortable with that. So the intended outcome is that the nursing staff's going to be thoroughly educated, feel like they are competent and are experts in the information of signs and symptoms of preeclampsia and what the patient should do if those signs occur. So after the in-service, I am going to give the nurses a quiz. It's a 6-question quiz to just assess their knowledge of the material that we cover in the in-service. I will look those over immediately at the end of the in-service, and if anyone is in need of some review or some remediation, we can immediately address those concerns. And then a month after the in-service, we're going to redistribute the surveys that I did at the beginning, asking about are they educating patients with postpartum preeclampsia. And this is hopefully going to assess for a change in their practice. I'm hoping that number is going to go way up, that instead of 1 saying they always provide that education, that number is going to be much higher. So that is my overview of my project. I hope that I gave you a clear picture of my goal and how this is going to transpire. I'd welcome any feedback and answer any questions that you might have. Thank you so much.